Hi, I'm Kevin Hall. I'm an instructor here at West Coast Florida CPR. I'm here to explain to you guys about third degree heart block, second degree type 1, second degree type 2. So we're going to show you how to find out if it's a third degree heart block. The first thing you'll want to do is go ahead and get rid of the third degree heart block as a possible choice. So first thing we do is it a block? We have a P wave without a QRS complex. So that shows you that it is a block. So now we got to assess whether it is a third degree, whether it is a second degree type 1, second degree type 2. So what we'll want to do is look at our R to R waves using our finger calipers. So as you use your finger calipers, you notice that the R to R's are exactly the same every time. And so if the R to R's are the same every time, you're looking at a third degree heart block. So now we're here with a different type of heart block. So we got to find out, is it a third degree? So let's get our finger calipers and take a look. We're checking our R to R's, but we're missing one. So immediately we know it's not a third degree heart block. So we're going to get that out. So now we want to look at the PR interval when we get a QRS complex. So as you see the PR interval, the little P between the R wave, when we look at that, we're going to see that the PR interval is exactly the same each time we have a QRS complex. So that makes this a second degree type 2. So let's look at a new one. Here we got to see if it's a block first. We see a P without a QRS complex, so we know there's a block. So we want to rule out third degree heart block next. So we go R to R wave, and there's not one right there, so it cannot be a third degree heart block. So now we have to look at the PR interval. When we look at the PR interval, is it exactly the same? Well, this one's short, this one's a little longer, that one's longer, that one, and then it's missing totally. So as we see the PR interval is getting further away from the QRS complex, that makes a Winky block number 1. In other words, second degree heart block 1, also called a Winky block.